Pankhania joins us from Edinburgh. He's a senior clinical lecturer at the University of Exeter Medical School, and we always appreciate having you on the show. Doctor, earlier in our program, we spoke to another doctor out of South Africa who intimated that vaccines aren't the silver bullet for this pandemic, that it's masks and social distancing that are just as important. So how much of an impact does vaccine inequality really have?
Well, vaccine inequality has a massive impact, although we know that it is a multifaceted operation in that you have your vaccines and your infection control and your environmental measures like proper ventilation. Having said that, vaccines, without a doubt, prevent you from getting severe, serious illness, which ends up in hospitalization, on the ventilator, and death. So vaccines have a major role to play, but other factors are just as important too.
Well, who is to blame here then? I mean, Big Pharma was always going to go after profits, right?
Well, this is an indicator that our World Health Organization and the way we are supposed to work in an integrated way does not work. And when the vaccines were successfully invented and found to work, the Western countries bought up forward orders straight away. And so it is to the shame of the richer nations who bought up all the stock. It is the shame to the pharmaceutical companies who sold them all the forward orders to. And in the meantime, we have the WHO just waiting for donations and supplies of vaccines to immunize the rest of the world. There is one more problem also in poorer nations, which is failure of their own leaders to address vaccine hesitancy. So we've had vaccines delivered and not used because of vaccine hesitancy.
Are we going to see things even up, do you think, in 2022?
I expect things to even up, not because somebody has suddenly decided to become kinder, but because the European nations have already immunized a lot of their population, and other vaccines are now starting to come online. So you mentioned the Johnson & Johnson one, made in Africa for Africa, good. And there are other similar vaccines being manufactured at scale from India. And therefore, I expect the situation to get better by default rather than because the European nations or Americans have made it better.
Well, we will hold on to that glimmer of good news. Dr. Bharat Pankhania joining us from Edinburgh. Thank you.